Hi. Today we will troubleshoot some liver diseases like hepatitis and dengue and biliary system, written by Sherlock. Starting from the drugs like paracetamol, if given in high dosages, that is about 250 mg per kg, do cause risk of massive hepatic necrosis and liver failure. After 2 days of poisoning from paracetamol, jaundice starts appearing in the patient. Do check blood pressure of the patient regularly at this moment. There is a relief of obstruction may be there, which may be caused by unconjugation of hyperbilirubinemia. That is, the changes are reversed in lobar atrophy if and only if the hyperbilirubinemia is not caused by autoimmune deficiency. Further, lower edge of liver may be displaced in the athletes or singers in case of hyperbilirubinemia, which is diagnosed by palpation with hands behind right lower ribs. In these cases, the liver size is also restored and jaundice is relieved. That is, in case of hyperbilirubinemia due to absence of autoimmune deficiency. Coming to the mechanism of liver functions in healthy body, in general, excretory system of the liver begins with the bile conjugation. There are macrophages which play the important role in the liver functions, which are attached to endothelium and endocytose, the unwanted cell, like foreign cells, tumor cells, yeast cells, viruses, bacteria, parasites, and secrete metabolites, which have receptors for important gland functions like insulin, glucagon, and lipoproteins. Now, here comes the most important matrix, that is extracellular matrix, which play important role in liver function. That is, it regenerates the liver in case of liver function loss, partial loss due to hyperbilirubinemia, of course, but due to absence of autoimmune deficiency. Bile pigments have enzymes in the liver. There is increased serum bilirubin, which is detected by pathological tests. These estimations define urobilinogen, which is poor predictor of hepatic disease. Thus, further investigations are needed where in liver there is BSP, bromosulfilin, which is rapidly removed by the liver and excreted in the bile, containing extracellular matrix. There is indocyanine green, which is removed by the circulation of bile in the liver. So this was the liver function. Now coming to the diagnosis for the improper liver function, there are of course serum bilirubin enzyme tests which define the type of liver injury, which may be elevated by dietary intake, that is fats. There is alkaline phosphate level which rises in cholestasis or liver injury, and to a lesser extent where liver cells are damaged proves fatal as intrahepatic bile duct obstruction caused by these lesions. There are gamma glutamyl transpeptidase, a known disease specific enzymes, and aminotransferases, mitochondrial enzymes. Two of these get very much reduced, leading to aggravation of serum levels. So diagnosis is done by these enzyme tests which are discussed above. Further tests are done by quantitative assessment. There is galactose elimination capacity, there are breath tests, there are sampling tests, that is, samples are taken of salivary caffeine. These all tests discussed above may discriminate mild liver disease from advanced liver disease, that is, cirrhosis or advanced liver disease. Further, few more tests which are done in the liver disease include drugs like antipyrin tests. There is glycoprotein receptors, which include computer analysis tests, where excretory capacity is abundant because of capacity, cost, and unwanted reactions. There are old methods like bromosulfilin test to estimate the S factor and T factor of the patient with liver disease. Now, these were the diagnostics in the liver disease. Now, what basically happens in the liver disease, the mechanism of abrupted liver functions. The lipid and lipoprotein metabolisms are shaken up. There is cholesterol which gets deposited in the cell membrane in the absence of ultracentrifugation, and these cholesterols gets retained. Normally excreted bile thus leads to regurgitation of biliary cholesterol in the blood circulation. There is a chain reaction develops, that is, increased hepatic synthesis of cholesterol reduces plasma LCAT activity. There is a parenchymal injury, that is, triglycerides tend to increase, hence fatty liver recommendation of the person suffering from liver disease. Now, what happens in the more precise form? There is also the role of bile juice acids in the liver, which are conjugated with the amino acids, lead to very dangerous isomers. There are micelle formations, fat absorption, of course. There are increased acids like lithocholic acid, taurolithocholic acid, and serum bile acids, which leads to enzymatic hydrosteroid and dehydrogenation. Further detected are sulfide esters, which are the real culprits in the liver disease. General amino acid metabolism, which gets activated from the intake, breakdowns and produces ammonia and urea, and plasma, which is highly concentrated in liver disease, particularly in hyperinsulinoma and hypergluconemia. Patient is diagnosed with hepatocellular disease. There is a reverse happens in another disease of the liver called carcinoma, where plasma proteins fall drastically, that is, hepatic synthesis is decreased, leads to production of alpha tetroproteins. Now we have switched from low level of liver disease to advanced liver disease. So, how diagnosis is done in advanced liver disease? Here comes the electrophoresis. In electrophoretic pattern of serum proteins is observed and changes are being observed which are much conspicuous, that is much clear in hepatitis. Further, there is a data science is being applied as carbohydrate metabolism or blood glucose level is drastically decreased independent of insulin secretion. Another diagnostic method includes biopsy of liver is done using a convex needle, that is a invasive method to mark the level of glycogen. When it is biopsy is done only when the other less invasive methods are failed. Now continuing with the advanced liver disease, the pathogenic changes include pneumothorax, leads to prehepatitis. There is an obstruction which is detected in biopsy, which causes further hemorrhage and clotting and bleeding puncture at the portal, which is with the tear of liver, and patient is having deep breathing. There is biliary peritonitis in the gallbladder and bile duct in an unusual position. Do hydrate quickly yourself, that is your body as well as your eyes. Now continuing with the pathogenic changes in the liver disease, blood culture for infection is done, that is coming to the diagnosis. Blood culture is done, sampling is done for focal glomerulus disease and tumor deposits. In this level of liver disease, abscess may be missed if cutting serially or in large amounts. There may be appearances of naked eye greenish central areas in vascular centers of lobules. Now, point to be noted here is that serial sections are important for isolation of sinusoidal dilation in search of tumors. In the liver disease, always history of the patient is very much important to detect the level of liver disease, but diagnosis is very much difficult in liver disease. So scientists have developed other diagnostic methods like electron microscopy and histochemistry. So the key is to define the right diagnosis at the right time. Where our sampling is difficult, biopsy is done. Where biopsy is difficult to mark the level of liver disease, electron microscopy is done. So various methods of diagnostic methods are applied on the patient with liver disease, especially advanced liver disease. Most of the time, bleeding is diagnosed as the advanced liver disease, which is followed by series of further phases of bleeding where plasma is very much high. Now, continuing with the serious patients of advanced liver disease, there is erythrocyte change, red cells become hyperchronic, bone marrow becomes hyperplastic, there are folates and vitamin B12 deposits, there is megaloblastic anemia, leukopenia, platelets abnormalities in the liver. Even vitamin K treatment fails at this level of advanced liver disease where bilirubin is very much increased. PT time test for hemolytic jaundice where bilirubin is increased is done. Further, the disease advances of the liver of the patient. The other pathogenic changes which detected are liver enlargement, large macrophages, dark bile juice, large spleen, and hemosiderosis occurs. The limbs responses in the advanced liver disease like leg ulcers, fungus deposits. Besides the common symptoms of liver disease, that is fever and chills, there is blood transfusion leading to microlymphoproliferation, that is multiple cells formation, and patient suffers portal hypertension. There is GI hemorrhage, that is gastric intestinal hemorrhage. Further, patient develops fibrosis, that is inflammation of cells, liver cells. Patient may complain leukemia, and sampling done at this stage of advanced liver disease includes pale samples. And patient requires immediate bone marrow transplantation, which may have another complications, that is if patient exposed to infection may lead to hepatorenal failure, that is acute renal failure, and hepatomegaly, which is detected through CT test, MRI test, magnetic resonance imaging, and laparoscopy. In general, the mechanism of liver injury is always unknown, so a series of investigations are done on a patient with liver disease. The causes may be drug toxicity, overdosage of broad spectrum antibiotics. Now, continuing with the pathogenic changes in the advanced liver disease, there may be orange colored liver, hepatocytosis, esters, fibrosis, sea blue syndrome, hepatopulmonary syndrome, arterial oxygen saturation, pneumonia, and patient may goes to coma. There are star-like cells appearing in the diagnostic laboratory tests, and at this stage the patient requires immediate liver transplantation, which requires close monitoring, and patient is admitted to ICU. Prompt treatment is required without any delay. Experienced management is required. Live or dead donor is required immediately. There is ascites control with the help of diuretics and low sodium. And with the complication of liver transplantation, most of the time testings and large investigations are being done. So liver transplantation is prevented in most of the cases. Investigations are being done to find the level of liver disease. Now coming to the females, in case of a jaundiced woman in her trimesters, immunoglobulin drugs and vaccines are required to be given without any oral contraceptive drugs at the right time. Jaundice may be caused due to environmental factors, otherwise, fetus will develop the disease. It takes about 2 weeks post vaccination to develop antibodies against any infection. So, this was the hepatitis in low level and advanced level stage. Another liver disease is dengue. Dengue fever attacks the human being in similar pattern, and it may be prevented, or if it occurs in the human being, it can be treated. So do take medication regularly, do take care of yourself, dehydrate yourself frequently. Lockdown, as the Russian says, made us to regroup our energies towards creating serenity for one another, to grow our minds, warm our hearts, and keep our bodies fit and strong. We have no option but to use a little creativity and innovation to enjoy our days without a sense of monotony. It's a wake up call, guys, to cherish one another. Have a nice day, nice time.